Hi all, welcome to Facebook Live. Today we are here to discuss on the topic the sunshine vitamin, bones and beyond. To discuss on the topic, we are with Dr. Sridhar Mutsiala, consultant for orthopedics at Citizen Specialty Hospital, Nalavilla, Hyderabad.
Hello all. I am Dr. Sridhar Mustiala, FRCS Orthopaedics. I've been associated with Citizens Hospital for the last 5 years or so. I've got special interest in hip and knee arthroplasty and shoulder and knee arthroscopy, that is sports injuries. In addition to it, that I deal with common cases of trauma and other sports injuries. I'm also very passionate about educating, motivating people to lead a healthy lifestyle, especially in relation to bone, in preventing low back pain and knee arthritis. Hence the reason for choosing today's topic also, that is vitamin D.
So firstly, I would like to ask what is vitamin D and why is it important?
Yeah, vitamin D is one of the vitamins. For our body metabolism and functions, we need a lot of nutrients. The major nutrients being protein, carbohydrates and fats. And then there are micronutrients, which are vitamins and minerals. And vitamin D is one of them. Now, why is it important? Especially in relation to orthopedics, vitamin D plays a very important role in bone health, bone metabolism and joint health. And it is important because the prevalence of vitamin D deficiency in our community is about 75%. That includes males and females. And it is often underdiagnosed and undertreated. Hence, it's very important to educate the people on the role of vitamin D in bone and joint health.
So secondly, what are the sources of vitamin D?
Yeah, as you said, it is called the sunshine vitamin because vitamin D is endogenously produced. That is, our body itself produces vitamin D when we are exposed to sunshine. Hence, it is called the sunshine vitamin. When sun, especially some frequency ultraviolet rays fall on the skin, the precursors of vitamin D are converted into the active metabolites of vitamin D in the body with the help of liver and kidneys, and the vitamin D is formed, which plays an important role, as I said, in bone and joint health. Since the sunshine plays a crucial role in producing vitamin D, it is called the sunshine vitamin. There are other sources of vitamin D as well, but they are very limited. There are some animal sources like fish, meat, egg yolk, etc. Coming to vegetable sources, there are hardly any sources of vitamin D in the vegetables. The only vegetable which has vitamin D is mushrooms, which are exposed to sunlight. But because most of the mushrooms nowadays are commercially grown, they don't have vitamin D. In Western countries, the bread and milk is fortified with vitamin D so that the general population get enough sources of vitamin D. In India, it is not a regulation as yet to fortify the milk and bread as yet.
So is deficiency a common problem and what are the causes for it?
Yeah, vitamin D deficiency is very common. As I said, about 75% of the population is deficient in vitamin D. The causes are multiple. Though it is easily available, as I said, when you are exposed to sunlight, you produce endogenous vitamin D. But in spite of that, we are deficient because of our work culture. We are always indoors. Adequate exposure to sunlight is not there. Even when we are in sunlight, we are fully clothed. So the parts exposed to the sunlight is very limited. Again, we use a lot of sunscreen, which prevents the absorption of ultraviolet ray and formation of vitamin D. And again, our color of the skin, especially Asian population, dark-skinned people, we have a lot of melanin in our skin. That also prevents absorption of ultraviolet rays. And the other reasons being, as I said, vitamin D is a fat-soluble vitamin. So, it is activated in the liver and the kidneys. People who have got liver or kidney issues or people who have got fat malabsorption can have vitamin D deficiency.
So how does the deficiency present, how the patients will be presenting it?
Yeah, the deficiency vitamin D, though common, it is underdiagnosed because the symptoms are very vague. The patient may present with non-specific fatigue, body pain, muscle weakness, difficulty in getting up and down the stairs or getting up from a chair, muscle cramps, etc. Vitamin D also plays an important role in bone healing and wound healing as well. So people who have got deficiency in vitamin D, the fracture healing might be delayed or if they have any wound or any problems, the healing might be delayed. It also can cause depression of mood and lack of sleep, etc.
So does it has other roles apart from bone health?
Yes, vitamin D has other roles as well, especially in immunity. People who are deficient in vitamin D are prone to recurrent respiratory infections. And as I said, healing, whether infection anywhere in the body, can be delayed. And as I said, it can cause depression and insomnia. And vitamin D is also thought to play an important role in controlling diabetes and blood pressure, and in controlling autoimmune disorders.
So what are the lab tests available for vitamin D deficiency?
There is a simple blood test available to check vitamin D levels. Normal vitamin D levels should be between 20 to 100 nanograms per ml. Anything less than 20 is called deficient. But normally I aim for levels of about 40 to 50 nanograms per ml for bodily functions, normal bodily functions.
So what are the treatments of vitamin D deficiency?
Yeah, a lot of formulations are available commercially now to treat vitamin D deficiency. They are available in capsule forms, sachet forms, that is powder forms, and also syrup forms. My normal protocol is I give 60,000 units once a week for about 3 months, then put them on a maintenance dose of about 60,000 units per month for life.
So what is osteoporosis and the causes and treatments for it?
Yeah, osteoporosis means brittle bone. As I said, vitamin D and calcium very important for bone metabolism. People who are chronically deficient in vitamin D and calcium, they develop osteoporosis, where the bone density is decreased and hence the bone becomes easy to break. So a simple fall can cause fracture. Again, osteoporosis is very prevalent in India, again very underdiagnosed. I would recommend anybody above 50 to have a test called bone density scan, which can detect osteoporosis or osteopenia, which is the early stages of osteoporosis. And when treated at the right time and or prevented, it can save a lot of people from sustaining a fracture when they fall down. Coming to the symptoms per se of osteoporosis, most of the times osteoporosis is detected only after they have a fall and a fracture. But people with osteoporosis can be having chronic low back pain, which is not responding to a normal medication. In those patients, and as I said, anybody above 50, I would do a bone density scan to detect osteoporosis. A lot of medications are available for treating osteopenia and osteoporosis. In the early stages, drugs called bisphosphonates can be given, which are oral medication. But nowadays, there are injectables available for treating established osteoporosis in the form of a teriparatide injection, which is given subcutaneously every day. And then there is another form of injection called denosumab, which is given once in 6 months. You can contact your doctor to find out if you've got osteoporosis and all the measures you can take to prevent or treat osteoporosis. Osteoporosis again is a largely preventable disease. As I said, osteoporosis is bone density. So like when we are growing up, in the growing up age, you can do a lot of things to increase your bone density, especially weight bearing exercises in form of weightlifting or any physical activity like playing sports, which puts repetitive stresses on bone. It helps increase your bone density, and the bone density can be increased to a certain age only, say about 30 or 40. So I encourage the younger generation to be physically active, do some weight bearing exercises so that they can prevent osteoporosis in the future.
Thank you, sir. This brings much awareness towards the topic like vitamin D, which we get through the sunshine. Because nowadays, we all moreover, the old age people are facing these problems like knee problem and the back pain.
Yes.
Thank you, sir.
Thank you.